All right, this is Alexa Anderson. She's doing her trauma practical assessment for EMT Basic, and we'll begin. So you're called to a helicopter crash on the side of a hill, and unknown number of patients. Bystanders say they see one person walking around.
Okay. PP, is my scene safe?
Yeah, the helicopter is not on fire, not leaking anything. It's been turned off, secured.
Okay. What am I seeing?
So you have a female patient, about 50 years old. She's just walking around, kind of dazed state, and that's all you see outside.
Okay. How many patients?
You also have a male patient who's appears to be the pilot seat, unconscious.
So, upon arriving to the scene, I see a female patient who's walking around dazed and confused, and then an unconscious male who appears to be a pilot.
Mm-hmm.
Okay. Does the female have any known injury or any obvious injuries?
You're not seeing any. She's
Okay.
just walking around, kind of in a dazed state.
Okay. So, due to mechanism of injury in multiple patients, I'm going to call for additional ALS units. Okay, and then I'm going to go to the male. Does he have a pulse?
Yes, male has pulse.
Okay, so then I'm going to check for his level of consciousness. Hey, you okay?
No response.
What about the pain?
Yep, you kind of grumbles when you rub his sternum.
Okay, so now I'm going to check his ABCs. Is his airway clear?
Airway appears to be clear.
Okay, what about, is he breathing adequately?
Yep, he's got good chest rise, probably about 10 breaths per minute.
Okay, what about, does he have a pulse?
Yep, he has a pulse.
Okay, so I'm going to put on a non-rebreather mask to assist with breathing.
Mm-hmm.
And then, because of mechanism of injury, I'm going to do C-spine precautions and place a C-collar. Okay, are there any obvious bleeding or injuries?
You're seeing he's got pretty good gushing blood coming out of his right arm.
Okay, gushing, not spewing.
Yeah, spurting.
Okay, I am going to put gauze on it and pressure. Is that helping?
No, it's bleeding through. It's still spurting.
Okay, so I'm going to apply a tourniquet. I'm going to use your arm.
All right.
What part of the arm?
So we'll say it's his left arm. No, right. We'll be right since it's
What part?
so up, he's bleeding right here, out of his radial ulnar area.
Okay. Put on tourniquet. Really tight. And did it stop the bleeding?
Yep, bleeding is stopped.
What about radial pulse?
You don't have one.
Okay. And now I'm going to do a quick blood sweep. Any bleeding?
No, just heavy blood on that left arm, and you're feeling his right arm, or his left arm has a pretty good deformity in his radius and ulna.
Okay. I'm going to cut off his clothes. Open it up, expose it. What do I see?
You're not seeing anything obvious other than deformity on his
Engine
left arm.
262.
Okay.
Respond to
So-
unconscious or fainting. At 123 West Daybreak Lane.
Okay.
123 West Daybreak Lane. In Saratoga Spring, engine 262.
So
123
I'm going
West
to
Daybreak
very
Lane.
quickly do assessment for injury.
Yep.
How's his skull and face?
Skull and face are intact.
Any fluid from the ears?
Nope.
Any JVD or tracheal deviation?
Negative.
How about his chest?
Chest is stable.
Abdomen?
Abdomen's rigid and hard.
Okay. Pelvis?
Pelvis is stable.
Left leg?
Leg is stable.
Right leg?
Yep, it's stable.
Left arm?
So his right arm has a
Right
tourniquet.
arm?
Right arm has the tourniquet on, placed and bleeding from the radial ulna.
Oh yeah. Left arm?
Left arm has a deformity on his radius and ulna.
Wait, he has a injury on both arms?
Mhm.
Is this one broken? I mean, obvious deformity?
Yes.
Okay. So we make note of that. Put it in a safe position. I'm gonna have my partner help me put him on a backboard. And then my partner will hold his head 1, 2, 3, boom. And then I'm going to check his back.
Yep.
All the way from his C-spine to his coccyx.
I'm not noticing any deformity.
Okay. And put him on the backboard, strap him in. We're going to put him in the ambulance. Okay, now I'm going to listen to his lungs.
And the sounds are clear.
Okay. I'm going to splint his arms. Both of them. Because they're both broken, maybe?
Yep.
Okay. And then wrap it up with some gauze over the injury. Keep his wrist exposed so I can take his pulse.
Yep.
Does he have a pulse?
Yep. Earl, no, he doesn't have bolts in that arm.
Oh,
It's
no.
another tourniquet.
Oh, yeah, that's right. We'll leave the tourniquet on though. Okay, and then I'm going to do the same thing to his other arm. Does he have a pulse?
Yep.
Okay. And we're doing a rapid transport to the hospital. And then I'm going to take his baseline vitals. What's his pulse rate?
So pulse is 126.
And his respiratory rate?
Respiratory is about 22.
Okay, so I'm going to have my partner.
Oh, no. Sorry, excuse me. Respiratory is about 12.
Okay, so it's normal. And then his his blood pressure.
Blood pressure is about 96 over 78.
Okay, so I'm going to treat him for shock and put a blanket on him. Okay. And then just continue with rapid transport and check vitals every 5 minutes until we get there, until the hospital.
All right. Anything else you'd like to do?
No.
All right. I will end that.